All right. Great. Well, good morning, everybody. It's very early. Um, Heather Chubb with the Chubb Law Firm. We are aging care navigation law firm, and today I am so pleased. My guest is Stuart Stackhouse, and he is a Medicare broker. He is going to make us smart about Medicare, what it is, what it isn't, some differences, and hopefully it's going to answer a whole lot of questions and bring some of the mystery surrounding Medicare, lift that mist all the way away. So, Stuart, welcome. Thank you for being here, joining me this morning.
Well, good morning, Heather, and I appreciate the invitation to come and chat with you, even though it is a little earlier than I typically talk. It's a fun topic to chat about. I have a big sticker on the back of my car that says, "Are you puzzled by Medicare?" And as people drive by, they nod their head up and down.
That's awesome. I love the puzzle image because it really is a puzzle. So let's start with a really easy question. What actually is Medicare?
So Medicare was designed and started in 1965 as health insurance for people 65 and older. It has two different parts. Those two parts are Part A and Part B. It's that's what we refer to as original Medicare,
Mhm.
and we work throughout our life and pay certain taxes. And as long as we've paid in and earned what's referred to as 40 credits, then we will be able to access Part A of Medicare without paying a monthly premium. Part A covers our hospital services, acute hospital services. It covers skilled nursing, which is sometimes referred to as rehab.
Mhm.
It covers home health care. Home health care is when, usually after you've been discharged, one of the first two, you receive a professional, a skilled professional that comes to your home, a registered nurse to do wound care, a physical therapist to help you get you back on your feet if that's appropriate, a respiratory therapist. But they're skilled people. They're there to help you continue your recovery process, and they're not there as a custodial person. In other words, I like to say that they're there and they won't make you a sandwich. But if somebody was nice enough to leave one in the fridge, they'll probably go get it for you, but not necessarily. And last is hospice services, and that's end of life care, easing us on to the next plane.
Great. And then just for clarification, so that's all under Part A. And
Correct.
Part B is.
Part B is what we use most of the time, and Part B has a monthly premium. The premium cover that Part B is doctors, specialists, therapists, imaging, diagnostics, labs, durable medical goods, hospitals, wheelchairs, oxygen, and some medications that we, oddly enough, refer to as Part B medicine. And it's things like chemotherapy, infusions, usually quite expensive, need to be delivered by a medical professional in a medical setting.
Okay, great. So now we kind of know what Medicare is, what it covers, and we just talked specifically about traditional Medicare. Um, so it's an entitlement. We've paid into it. How does it actually work when you know, when you need it?
Well, when somebody accesses Medicare after they've registered for it, then it gives us a wide latitude to select our doctors. There's ability to access, the numbers fluctuate a little bit, but relatively about 80% of the doctors in the United States accept original Medicare. and we're allowed to visit any of those doctors anywhere in the United States and her territories that accept original Medicare. They do have to accept you as a patient.
Mhm.
Referrals aren't required necessarily. Doctors will probably ask for a referral because they want to see your medical records and make sure that it's appropriate for them to see you as a patient if it's something other than a primary care doctor. Uh, the Pick up the phone, call a doctor, and when you arrive at the office, if all you have is original Medicare, Part A and B, show them your original Medicare card. They will charge. Part B does have, well, we'll get into the costs in a moment.
Okay, great. So, traditional Medicare is very much like the health insurance that most of us have. Um, you choose your doctors, you go, but you have to be age 65 in order to first get Medicare. Is that correct?
Generally, that's true, but there are some people who gain access to Medicare earlier than 65, and that's usually through disability. Medicare is accessible after somebody has been awarded Social Security disability in their 25th month, or somebody less fortunate that has had a catastrophic accident or develops certain what we refer to as dread diseases,
Mm.
things like end stage renal disease, dialysis, somebody who may have ALS, also known as Lou Gehrig's disease.
Mhm.
And that qualifies them fairly quickly for that.
So they could be under the age of 65 and still be able to get
That's true.
regular Medicare.
Unfortunately, I have customers in their 20s
Hmm.
that have it through disability.
Hmm. Okay. All right. Um, what does it actually cost?
Well, that's a pretty big question.
Hmm.
I talked a bit about Part A and saying that there's no monthly premium, but Part A is not free. There is a large deductible if somebody is admitted to the hospital, even for just one night. After an extended hospital stay, then there are daily copays. There is those copays can increase if it's an even longer stay. And with original Medicare Part A, people can actually run out of those days and have to pay out of pocket.
Hmm.
It's unusual, but unfortunately, it can happen. Part B has a monthly premium. Currently, that monthly premium is $187 a month. That number fluctuates annually as Medicare, the Centers for Medicare and Medicaid Services, or CMS, uh, researches and analyzes how much the cost is to our population across the United States with Medicare. And they do increase it based on that. Sometimes, if there's not a lot of inflation, we can have what's called a hold harmless, and the costs won't go up. That happened in the late teens, 20 teens. And then there's also a possibility every once in a while it goes down. Not common, but did go down a bit a couple years ago.
Okay.
There's Medicare itself, Part B,
Hmm.
has an annual deductible of $257 this year. And then after that, we say in general, Medicare Part B pays about 80% of the cost of what Medicare allows. And then the recipient is responsible for the other 20%, which refer to as coinsurance. And in some unlikely cases, there's something we refer to as excess charges, where doctors who will take Medicare, but not what Medicare agrees to pay, they're allowed to charge up to 15% over
Hmm.
that Medicare allowed amount.
Okay. So this is traditional Medicare. It has the copays, it has deductibles, and there's a portion that's not covered. Is there a way to fill that gap? Can somebody purchase another policy that fills those gaps?
Yes, in 1965, insurance companies looked at that gap and said, hey, we can create something that fills the gap or pays the gap that Medicare doesn't pay. And Medicare supplements were created, uh, often referred to today by CMS, Medicare, as Medigap plans. Currently, there's plans A, B, C, D, E, F, G, L, K, M, and N available. No, I didn't mislearn my alphabet. Those are the plans that are available. The plans themselves are regulated at the state level. However, in 2010, with the advent of the Affordable Care Act, each one of those letters or plan names were standardized. So, Company A has the same core plan K benefits or the same core plan N or G benefits. Plan C and F are still available for people who had Medicare or were eligible for Medicare prior to January 1st, 2020. So it's not that they can't get it, it's just if they don't have one, they are eligible to get one. People who are eligible after January 1st, 2020, are not eligible to purchase a Plan C or Plan F.
Okay. And those different plans cover different things, but the standardization is meant for the consumers to make it easier for them to compare what's
Correct.
going on,
Correct.
right? Okay.
Generally, the difference is the premiums
Mhm.
and then any ancillary benefits that the carriers, the insurance companies, add to those particular plans.
Okay. Great. Um, we're running out of time a little bit. I got a couple of
Okay.
really important questions. So we just talked all about traditional Medicare, but there's another option under Medicare called Medicare Advantage. Tell us a little bit about that and how it may differ from traditional Medicare and why somebody might want to choose that or not.
Okay. So Medicare Advantage plans are Part D of Part C. I'm sorry, Part C of Medicare is a plan where somebody says, "I've looked at this particular insurance company's plan offering, and I want them to manage my healthcare dollars." That during the annual election period, October 15th to December 7th, they say to Medicare, hey, I'm going to choose that particular Medicare Advantage plan. I like their terms and conditions, and I agree to them. And then every month, Medicare pays that insurance company a reimbursement amount for that Medicare recipient. And then the insurance company manages those dollars, and the premiums are generally quite a bit lower than a Medicare supplement plan. They often add things that Medicare doesn't cover, like dental, vision, and hearing, and maybe some other benefits, a gym membership. And because it has a lower monthly cost, people agree to those terms and conditions and like the extras, then they enroll in a Medicare Advantage. Today, it's roughly 54 to 55% of our population of Medicare recipients that are enrolled in a Medicare Advantage plan. There, it's appropriate for certain parts of the population, and Medicare supplement plans or Medigaps are appropriate for another part of the population. It's a very individual choice, and we as brokers, myself, try and help people learn to tailor which one of those options is most appropriate for them at that time.
Sure, sure. So I know a lot of people um, tend toward the Medicare Advantage plans because they see that as a lower cost option. But sometimes, but the coverage can be different than traditional Medicare as well. Is that correct?
Well, I think that's a bit of a misconception.
Okay.
Medicare Advantage plans cover everything they have to cover everything that original Medicare covers. So they
Mhm.
cover all the Part A and Part B. The cost sharing might be a little bit different. And where with just original Medicare, if somebody opts not to have a Medicare supplement or not to enroll in a Medicare Advantage, that 20% coinsurance has no ceiling.
Right.
So it can be incredibly expensive.
Okay. Um, so we are running out of time, but one final question. What's the future of Medicare? I know people are really concerned about kind of what's going on in the country today, and there's probably a lot of misperceptions. Can we help people feel a little bit more confident?
The Medicare Trust Fund is funded, likely, it looks like, through a minimum of the early 2050s. The plan, the cost share for us as recipients will likely go up as everything has done over our lifetime. I don't have any significant worries that it's going to disappear. People won't be able to get it. And it's something of such great value. We should be very thankful that as we've worked long and hard, that we can access a program like Medicare. I turned 65 in July.
Haha.
I've just enrolled in Medicare. It was an easy process. I went into my Social Security .com account and signed up, and it went smoothly. I didn't have any problems accessing it. I had already verified who I was, and it was a simple process. But if somebody has questions, I'm happy to walk them through that.
Great. Great. Stuart, I am so pleased that you came on today. I think we could do a whole nother session and help people learn a whole lot more. Um, but you are here to help people understand Medicare and pick the right plans for themselves because people have choices, right? Whether it's a Medicare Advantage plan or a Medicare supplement plan. Great to get educated and choose one, and that's what you help people do.
Yes, it's somewhat complex. It can be fairly straightforward, but it is something that people are afraid of,
Mhm.
and I help take that away and walk them through the process so that they can learn to put those pieces of the puzzle together and be confident in the selection that they make.
Excellent. Excellent. Well, thanks for getting up early and joining us. I think we'll
Well,
have you on
thanks.
again.
Yeah, well, thanks, Heather. I'd love to come back, and I certainly appreciate being able to give a little tidbit to people, and hopefully that answers some of your and their questions.
Mhm. Wonderful. Wonderful. Thank you.